Good morning and welcome to the February 2022 open meeting of the Federal Communications Commission, where we're celebrating Black History Month and also Valentine's Day this week. Madam Secretary, would you please introduce our agenda this morning?
Thank you, Madam Chairwoman. Good morning to you and good morning, Commissioners. For today's meeting, you will hear 3 items for your consideration. First, you will consider a further notice of proposed rulemaking that would seek comment on reforms to the urban and rural rates determination process for the Rural Health Care Program's Telecommunications Program, revisions to Rural Health Care Program rules governing the internal funding cap on upfront payments and multi-year contracts, and modifications to the Rural Health Care Program invoicing procedures. Second, you will consider an order requiring Iowa Network Access Division, doing business as Orion, to file cost and demand data to enable Commission staff to calculate appropriate refunds due to Orion's customers after 2 investigations into Orion's tariff switched transport rate. Third, you will consider an enforcement matter. Please note item 3, updating technical rules for radio broadcasters, updating outmoded political programming and record-keeping rules, as listed in the Commission's February 11th Sunshine Notice, has been adopted by the Commission and deleted from today's agenda. The first item on your agenda is entitled Promoting Telehealth in Rural America and will be presented by the Wireline Competition Bureau. Chris Monteith, Chief of the Bureau, will give the introduction.
Thank you, Madam Secretary. Ms. Monteith, please proceed.
Good morning, Madam Chairwoman and Commissioners. The Wireline Competition Bureau, together with the Office of Economics and Analytics, is pleased to present for your consideration a further notice of proposed rulemaking that, if adopted, would seek comment on revisions to the rules for the Rural Health Care Program, most significantly, the methods for determining urban and rural rates in the telecommunications program. I would like to thank the Bureau team and our colleagues in the Office of Economics and Analytics and the Office of General Counsel for their hard work on this item. Kiara Ortiz, an attorney advisor in the Wireline Competition Bureau's Telecommunications Access and Policy Division, will now present the item. Kiara.
Thank you, Chris. And good morning, Madam Chairwoman and Commissioners. In today's further notice of proposed rulemaking, we seek comment on revisions to rules and procedures that would reform the rate determination process in the Rural Health Care Program's Telecom Program and improve Rural Health Care Program administration. The Rural Health Care Program provides funding to eligible rural health care providers for telecommunications and broadband services necessary for the provision of healthcare. The program is made up of 2 programs, the Healthcare Connect Fund Program and the Telecom Program. Pursuant to Section 254 H1A of the Act, eligible healthcare providers are entitled to obtain rates for telecommunications services in rural areas at rates comparable to the rates charged to customers in urban areas for similar services in a state. In 2019, the Commission directed the Universal Service Administrative Company to develop a database of urban and rural rates to be used to determine median rates for the telecom program. Due to anomalies in the median rates generated by the rates database, however, the Commission waived its rule requiring use of the rates database for funding years 2021 and 2022. Today's further notice seeks comment on reforms to the telecom program rates determination rules. First, the further notice seeks comment on the rules and definitions for categorizing rurality and what services are similar to one another, which are 2 critical cost factors for any funding determination mechanism. Next, the further notice seeks comment on improvements to reporting requirements and data quality to ensure reliability of the data used to determine rates. The further notice then seeks comment on an alternative rate determination mechanism. Specifically, the further notice first seeks comment on a revised version of the rates database with a focus on establishing rurality and similar service groupings that result in accurate rates. Then the further notice seeks comment on alternative approaches that could more accurately determine rates, including a regression model proposed and drafted by the Office of Economics and Analytics, discount tiers, cost curves, and other alternatives put forward by Congress. In addition, the further notice proposes 2 rule changes to improve overall rural healthcare program administration. Specifically, the further notice proposes to apply the internal funding cap on upfront payments and multi-year commitments in the Healthcare Connect Fund program only when demand exceeds available funding, and when this occurs, to target funding for equipment and services needed in that funding year as opposed to future years for multi-year contracts. This further notice also proposes to harmonize invoicing procedures across the rural healthcare program by applying current invoicing rules in the Healthcare Connect Fund program to the Telecom Program. This proposed change is intended to protect against waste, fraud, and abuse. The Wireline Competition Bureau recommends adoption of this item and requests editorial privileges. Thank you.
Well, thank you. We will now hear comments from the bench, and we will start with Commissioner Carr.
Thanks. Manicodic, Alaska is a remote one-street village that sits roughly 340 miles southwest of Anchorage. Your Waze app isn't going to help you get there, and there isn't a lot of traffic on the town's single dirt road because the community is completely cut off from the highway system. The village is nestled between a small mountain called Acorn Peak and one of the meandering bends of the Igishik River. It's a bush village that can only be accessed by air or water. And that presents a unique set of challenges for the 440 or so people, mostly Alaska natives, that live there. Access to affordable, high-quality healthcare has long been one of those challenges. The closest hospital is in Dillingham, and I had the chance to travel to Manicodic from Dillingham back in 2018. After taking a regular commercial flight to Dillingham from Anchorage, we climbed a few rickety steps up into an old Grumman goose that was built in 1944. Despite its age, the pilot assured us that the plane was still a very airworthy craft. And good news from my perspective is that we didn't need to get that far off the ground during the roughly 15-minute commuter flight. We landed at Manicodic's gravel runway and hopped in a car for the 1-mile drive down rough roads to the village center. And that's where we met up with the healthcare professionals that work at the Manicodic Village Clinic. The team there talked about the value that a high-speed internet connection brings to their operation into other remote parts of Alaska. Rather than incurring the expense and time associated with life flighting someone out of the village, an experience that only isolates the patient from their family and community, Manicodic's internet connection allows the clinic to tap virtually into the healthcare specialists located back in Dillingham or Anchorage. And that means more patients are able to access affordable and quality care while getting to stay with their loved ones right in their home community. And that's a good thing. Vital telehealth connections like this are often only possible with support from the FCC's Rural Healthcare Program. Ensuring that this program has the sufficient and predictable levels of support it needs is not just a nice policy goal. It's a statutory obligation for the FCC. And on this score, the agency hasn't always gotten it right. In the past, the F support mechanism has led to unpredictable funding levels and inconsistent rates. Demand for funding has outstripped the program's annual budget, and the process of administering the program and processing funding requests has led to backlogs and delays. Senator Sullivan and others have been strong advocates for ensuring that the FCC corrects these mistakes and stands up for a program that meets the agency's statutory obligations. I've welcomed the chance to work with my FCC colleagues on doing just that. In 2018, for instance, we raised the overall cap of the program and established a process to adjust the cap annually to reflect inflation. In 2020, we waived the FCC's cap on upfront payments and multi-year commitments to ensure that all program requests could be funded in full during the COVID-19 pandemic. And then January and April of 2021, we issued waivers to address anomalies in the Telecom Program's rate database, anomalies that would have contributed to an inadequate and inconsistent level of support for providers. We've also waived a number of other program rules, provide relief to program participants, and alleviate administrative burdens throughout the COVID-19 pandemic. While these have been important steps in the right direction, it's clear that the FCC must embrace more fundamental and permanent changes to our rural healthcare program. This item explores how we can do just that. I'm pleased in particular that we're seeking comment on new ways of calculating rural rates that will not lead to the types of anomalies discovered in the rates database. I'm also pleased that today's item now seeks comment on whether the existing funding cap is sufficient to satisfy future demand or whether we should increase it. After all, serving remote healthcare clinics like the one in Manicodic requires expensive, years-long investments. We must ensure that the program provides the required certainty to providers year after year as demand for these types of services continues to expand. Finally, I'm grateful that my colleagues agreed to expand the item so that it now seeks comment on some of the administrative delays and other burdens that providers continue to face at USAC during the application and appeals process. Over the years, we've heard numerous complaints that USAC takes too long to process applications and make funding decisions. Today, we seek comment on whether there are additional actions the FCC can take to expedite application processing or require USAC to make funding commitment decisions in an even more timely manner. We also seek comment on whether USAC or the FCC should be required to act on appeals in a certain time frame, and whether there are other steps we can take to reduce administrative burdens and costs for providers while maintaining the integrity of the program. So I want to express my thanks and appreciation to Chairwoman Rosenworcel for bringing this item forward for a vote. I'm confident we can all work together to strengthen the rules so that they will benefit rural healthcare providers across the country. I also want to thank the staff as well, the Wireline Bureau, for their hard work on the item. It has my support. Thanks.
Thank you, Commissioner Carr. And in a coincidence, I too have been to Manicodic, Alaska, so I can vouch for everything you just said about it. Now we'll hear from Commissioner Starks.
Thank you, Madam Chairwoman. The COVID-19 pandemic has, of course, highlighted the importance of telehealth for millions of Americans. For people across the country, telehealth allows for remote diagnoses and treatments when patients can't travel to meet their doctors in person. This healthcare alternative is critically important to communities across the country and especially in rural America, which continues to see limited medical resources stretched even further. For doctors to stay connected to their patients, rural healthcare providers must have high-quality broadband services. The Commission's Rural Healthcare Program helps rural healthcare providers obtain the same level of connectivity, of course, as their urban counterparts at comparable rates. And so I'm glad that we're taking another look at this important program. When the Commission last considered changes to the Rural Healthcare Program back in 2019, I expressed then concern about how those changes would affect some of these healthcare providers and the telecom providers that serve them. And as I'd done in other proceedings, I called for the Commission to collect and utilize the best available data, raise some specific questions about how we could compare rates between those urban and rural communities. Of course, then Commissioner Rosenworcel shared my concerns. We both urged that the Commission conduct additional notice and comment. Unfortunately, those concerns were not all taken up. And as we feared, implementation of the new rules revealed serious problems, data used to calculate support. And so I now appreciate that the Chairwoman is taking these steps to address these issues and consider how we can make this important program even better. Today's order seeks input on those critical questions, like how to classify different areas based on rurality, how to differentiate similar services, how to improve data quality for rural healthcare providers, and whether we should adopt a transition period as we implement new rules. So we also take steps to reduce fraud, always a concern of me as an enforcement official, make programs more efficient and effective as well. And so I look forward to the comments and moving forward to improve this rural healthcare program. And thank you as well to the Wireline Competition Bureau for their hard work on this proceeding. Thank you.
Thank you, Commissioner Starks. Commissioner Symington.
Thank you. I'd like to express my appreciation to the Bureau staff for their diligent work on this item. Correctly setting support levels for the rural healthcare program has proved to be, as we've heard, a vexing problem since Congress mandated the creation of the program in the '96 Act. This further notice contains excellent proposals for fixing the numerous problems with our previous crack at this issue, the rates database. It also makes clear that the Commission is open to any and all suggestions from the public about how we might best proceed and put this program on sound footing for the long run. So I'm happy to approve.
Well, thank you, commissioners. It's been said before, and it will be said again. This pandemic has changed so much in our lives. As a nation, we moved so many things online. We converted all kinds of activities from physical to digital. We expanded the ways we communicate, and we have made it a priority like never before to connect all. But among the most revolutionary changes we have seen during this period have been in healthcare. You see it clearly in the heroism of medical professionals across the country, the development of new vaccines, and the expansion of telemedicine that has changed so much in healthcare so fast. After all, there was a time not that long ago when telemedicine technologies were strictly for remote communities. But this pandemic has changed all that. It has moved virtual appointments into mainstream medicine for urban America, rural America, and everything in between. Now, we've seen this up front at the Federal Communications Commission, where we have worked since the start of the pandemic to support healthcare providers with resources for video visits, remote monitoring, and online counseling. In fact, our new COVID-19 telehealth programs have distributed nearly $450 million in support since the pandemic began. And now we turn to a checkup on our oldest telemedicine program, the Rural Healthcare Program. For more than 25 years, it has been a force for good, supporting telehealth services before it was trendy or easy to do so. And I've witnessed the power of this program in pre-pandemic days in village clinics in Alaska and rural hospitals in Montana. And the creativity of the medical professionals and the gratitude of the patients that you see stays with you long after you've left. And today we are going to build on that and address some glitches that have ailed this program in the recent past. To be clear, we are talking primarily about the oldest part of the Rural Healthcare Program, which is known as the Telecom Program. And under the Communications Act, this program provides support to rural healthcare providers for the difference between the rates they are charged for communications and those they would be charged for comparable service in rural areas, in urban areas, excuse me. In practice, the Telecom Program is a lifeline that supports telehealth efforts in some of the most remote parts of the country. So we have to get our reforms right. But I think the FCC got some of its reforms to this program wrong during the last few years. It set up a database of urban and rural rates that use tiers to determine what the telecom program would support. But this database had real problems. For example, in Alaska, the database featured a rate for a dedicated transmission service in the extremely rural tier. It was actually lower than the rate for the same service in the less rural tier. And in California, the database showed that a 50 megabit connection was cheaper than a 20 megabit connection. This doesn't make sense. So for the last 2 years of this program, the FCC has waived the use of this database. Now I think we need to fix it for good. So we offer a number of different options in this rulemaking, including a revised database of rural and urban rates, a regression model developed by our Office of Economics and Analytics, and other ideas. But the bottom line is we need a system that works for the communities that depend on the telecom program because it provides essential health care in places that need it most. And while we're at it in this rulemaking, we also ask other questions about other changes to the rural healthcare program, including revisions to our funding cap and ways to streamline the process for providers. And we take these steps because we want the rural healthcare program to thrive, not just in the past, not just during the pandemic, but in the future. Thank you to the staff who worked on this rulemaking, and that's Brian Boyle, Callie Coker, Adam Copeland, Charles Eberly, Jody Griffin, Chris Monteith, Kiara Ortiz, Haley Steffen, and Helen Zhang of the Wireline Competition Bureau, Keaton Cobble, Stacy Jordan, Eugene Kiselev, Eric Ralph, Donald Stockdale, and Shane Taylor of the Office of Economics and Analytics, and Valerie Hill, Richard Mallon, Linda Oliver, and Bill Richardson of the Office of General Counsel. And we will now proceed to a vote on the item. Commissioner Carr.
Approve.
Commissioner Starks.
Approve.
Commissioner Symington.
Approve.
The chair votes aye. The item is adopted with editorial privileges as requested. And Madam Secretary, please announce the next item on today's agenda.
Madam Chairwoman and
All right, have we lost our secretary? We'll give her a moment or two. She can reconnect.
Okay, I don't know how much you heard, but
We can start all over again, no problem.
okay. Thank you, Madam Chairwoman and Commissioners. Item 2 on your agenda is entitled Orion Refunds Data and will be presented by the Wireline Competition Bureau. Chris Monteith, Chief of the Bureau, will give the introduction.
Thank you, Madam Secretary. Ms. Monteith, welcome back and please proceed.
Thank you, Madam Chairwoman. The Wireline Competition Bureau is also pleased to present for your consideration this morning an order that, if adopted, would require Iowa Network Access Division, doing business as Orion Network Services, to submit certain financial data to the Bureau so that the Bureau can determine appropriate refunds for overcharged customers. Many thanks to the team in the Bureau and our colleagues in the Office of Economics and Analytics and the Office of General Counsel for their hard work on this item. Lee McFarland, an attorney advisor in the Wireline Competition Bureau's Pricing Policy Division, will now present the item. Lee?
Thank you. Good morning, Madam Chairwoman and Commissioners. This proposed order follows tariff investigation orders adopted by the Commission in 2018 and 2019 regarding Iowa Network Access Division doing business as Orion. Orion is a centralized equal access provider. It aggregates traffic traveling between rural incumbent local exchange carriers in Iowa and other networks, for which it charges a single tariffed switched transport rate. This proceeding has a long procedural history, including 2 tariff investigation orders, which I will briefly cover. In accordance with a 2017 Commission order concluding a formal complaint alleging, among other things, that Orion's switch transport rate was unlawfully high, Orion filed a tariff with a revised switch transport rate, which became effective March 1, 2018. Prior to the effective date of that tariff, the Commission suspended the effective date of the tariff by 1 day and commenced an investigation, resulting in the tariff not being deemed lawful. The Commission's investigation led to a 2018 tariff investigation order that found the rate unlawful, and Orion submitted another revised rate. Prior to the revision becoming effective, the Commission commenced another investigation into the lawfulness of the rate, and the revised rate was not deemed lawful. Following a second tariff investigation order in 2019, finding the revised rate unlawful, Orion submitted a rate that became effective and deemed lawful on October 15, 2019. Therefore, in the 2 tariff investigation orders, the Commission determined that Orion charged unlawful switch transport rates for the period March 1, 2018 through October 14, 2019. Pursuant to the tariff investigation orders, Orion is liable for refunds to its customers who paid unlawful rates for switch transport. Typically, carriers liable for refunds as a result of a tariff investigation voluntarily submit a proposed refund plan. Here, Orion has failed to voluntarily submit such a plan. This order, if adopted, would direct Orion to submit cost and demand data for calendar years 2018 and 2019, so that the Wireline Competition Bureau can formulate a refund plan for Orion. The data are necessary to determine the appropriate refund amount for each of Orion's customers that paid the unlawful rates pursuant to the Orion tariffs that were in effect. The Wireline Competition Bureau recommends adoption of this item and requests editorial privileges. Thank you.
Thank you. We will now hear any comments from the bench. Commissioner Carr.
Well, thank you to Chris, Lee, and the whole team for the work. I really appreciate your presentation. I think it brings to light how much staff work goes on behind the scenes for these items. And we get to say a couple of words and a vote, and then it says the Commission does something, but it's really the staff that gets it done. As a former staffer, I appreciate that there's so much that goes behind each of these items that we get to vote on. So thank you so much for all of your team's work. It has my support.
Thank you. Commissioner Starks.
Thank you, Madam Chairwoman. As a former staffer myself as well, I second everything that Commissioner Carr said. Thank you for the hard work on this, and to the team, it has my support as well.
Thank you. Commissioner Symington.
Thank you. Not having been an FCC staffer, I can only marvel at the Bureau's ability to manage as such a technically complex item with its extensive history, and applaud its persistence for doing so. So thanks very much.
Thank you. And well said, Commissioner Symington. Our communications networks are complex. The connections required to complete every call require that every provider involved follows the law and obeys the rules. And here we have a provider, Orion, that aggregates traffic from small local carriers in Iowa and connects their calls to other networks. And to do so, Orion charges its customers a tariff rate. The law requires that those rates are just and reasonable. But in decisions in 2018 and 2019, the FCC found that Orion's tariff rate missed the statutory mark and it overcharged its customers. To bring this matter to a close, today we require Orion to file cost data so that we can calculate the refunds owed to its customers. To be clear, when this kind of thing happens, carriers typically voluntarily file a refund plan. Orion did not. So today we exercise our authority to compel them to do so. This is one provider offering services in one state. But the message we send here is broader. If you fail to follow the law and do not refund your customers what they are owed, we will act. And for their work on this effort, let me thank Lynn Engeldow, Justin Fall, Christopher Coves, Lee McFarland, Chris Monteith, Zach Ross, and Gil Strobel of the Wireline Competition Bureau. Eugene Kiselev, Richard Kwiatkowski, and Eric Ralph of the Office of Economics and Analytics, Anthony De Laurentiis, Lisa Griffin, and Rosemary McNerney of the Enforcement Bureau, and Melina Barzilai, Michelle Ellison, Rick Mallon, Linda Oliver, Bill Richardson, and William Scher of the Office of General Counsel. We will proceed to a vote on the item. Commissioner Carr.
Approve.
Commissioner Starks.
Approve.
Commissioner Symington.
Approve.
Chair votes aye. The item is adopted with editorial privileges as requested. Madam Secretary, please announce the next item on today's agenda.
Madam Chairwoman and Commissioners, item 3 on your agenda is an enforcement matter and will be presented by the Enforcement Bureau. Loyan Egal, Acting Chief of the Bureau, will give the introduction.
Thank you, Madam Secretary, and a big welcome to Loyan Egal, who is sitting in the hot seat here today for the first time. Because this order is an enforcement matter, we are going to switch it up, and just as the FCC has done in the past cases that involve similar presentations at an open meeting. As with all open meeting items, the Bureau circulated this to every commissioner at least 3 weeks ago, but there is a long-standing practice at the agency that we do not publicly disclose the targets of enforcement matters unless and until the commission decides to take action. For these types of items, this means that the agency formally votes on the item. Then here's a brief presentation from the Bureau before proceeding to any statements that the commissioners might have. This process ensures that these sensitive matters will not be publicly disclosed until the FCC has voted to take action, and we're following that precedent here. So we will now proceed directly to a vote on item 3. And on item 3 as an enforcement matter, I'll ask for my colleagues' votes. Commissioner Carr.
Approve.
Commissioner Starks.
Approve.
Commissioner Symington.
Approve.
And the chair votes aye. The item is adopted with editorial privileges as requested. Mr. Egal, please proceed with introducing item 3 on today's agenda.
Good morning, Madam Chairwoman and Commissioners. It is my privilege to present this as the first item in my capacity as the acting chief on behalf of the dedicated staff of the Enforcement Bureau. Thank you for your consideration and your votes on today's enforcement item. A notice of apparent liability for forfeiture against Gregory Robbins, Interstate Brokers of America, LLC, and National Health Agents, LLC. Presenting with me is Raul Rojo, Attorney Advisor in the Telecommunications Consumers Division. For their work on this matter, I would like to thank Lisa Gelb, Deputy Bureau Chief and Chief of Staff, Christy Thompson, Chief of the Telecommunications Consumers Division, Lisa Zena, Assistant Division Chief, Ashley Tyson, Legal Advisor, and Jessica Zena, Assistant Division Chief. Jessica Manuel, Attorney Advisor. I also want to thank the Office of General Counsel, the Wireline Competition Bureau, and the Consumer and Governmental Affairs Bureau for their invaluable support. Raul will now present the item.
Thank you, Leon. Good morning, Madam Chairwoman and Commissioners. This notice of apparent liability for forfeiture finds Gregory Robbins, Interstate Brokers of America, LLC, and National Health Agents, LLC, apparently liable for making robocalls without obtaining consumers' prior express consent in apparent violation of the Telephone Consumer Protection Act and the Commission rules. We propose a forfeiture of $45 million. In March 2020, the Industry Traceback Group alerted the Enforcement Bureau to a large number of robocalls soliciting health insurance. After conducting an investigation, the Enforcement Bureau identified Interstate Brokers and its owner, Gregory Robbins, as the parties responsible for the calls. The recorded messages falsely claimed that the annual health insurance enrollment period had been reopened because of the coronavirus pandemic. The messages solicited consumers to purchase health insurance products. The Bureau found that Interstate Brokers made 514,196 robocalls to wireless phones and 271 robocalls to landline phones in the month of March 2020 alone. The Bureau verified 10,000 of those calls to confirm that the called parties had not given prior express consent to receive the pre-recorded calls. This notice proposes a base forfeiture of $4,500 per each of the calls that we verified, for a total forfeiture of $45 million. The notice proposes to hold Gregory Robbins, Interstate Brokers of America, LLC, and National Health Agents, LLC, jointly and severally liable for willful and repeated violations of 227B1A3 of the Act and Section 64.1200A13 of the Commission rules. For these reasons and additional details laid out in the notice, the Enforcement Bureau appreciates the Commission's adoption of this item and requests a grant of editorial privileges for conforming edits. Thank you.
Thank you. We will now hear any comments from the bench. Commissioner Carr.
Thanks. Well, first, welcome aboard to the Bureau Chief. Great to have you back. I know you got some deep experience. We've had a chance to connect already in public corruption from working on the USF strike force back in the day. And so really glad to have your expertise and happy that the chair has tapped you. And we get to benefit from it once again from your public service. So thanks. And thanks to your team for its hard work on this item. Thanks.
All right. Commissioner Starks.
Yes, I have worked with Loyan. We worked together in the Enforcement Bureau and Loyan. As I said a couple of weeks ago, we are glad to have you. I'm glad to welcome you home to the FCC. Loyan and I also have served at DOJ, but we're glad that you're back at the FCC. Look forward to working with you and deeply appreciate all the expertise that you bring and working with you. To the item itself, there are numerous and ongoing efforts to stem the tide of unwanted and illegal robocalls, yet Americans continue to receive billions of unsolicited robocalls each year. Many of them come from telemarketers or lead generators, like Mr. Robbins, who place robocalls to phone numbers they purchase, or to phone numbers secured from unsuspecting consumers, in this case, those seeking information about healthcare insurance. Here, Mr. Robbins allegedly placed more than 500,000 robocalls in 1 month to consumers without getting their express consent, including almost 250,000 calls to numbers on the National Do Not Call Registry, thereby ignoring the rights of consumers not to be bothered by unwanted pre-recorded calls under the TCPA. Given the large number of verified calls found to have been placed without express consent, I support the significant forfeiture penalty proposed herein. Thank you as well to the Industry Traceback Group for alerting us to this illegal robocalling campaign, and I appreciate the hard work as well of the entire team there in the Enforcement Bureau in investigating and uncovering the extent of the harms caused to everyday consumers by these violations. I will be approving. Thank you.
Thank you. Well said, Commissioner Starks. Commissioner Symington.
Thank you. I'd like to join my colleagues in welcoming Mr. Igal. Furthermore, I'd also like to thank the team for their dedication to resolving the continued pressures that unwanted and deceptive telecommunications marketing is placing upon so many Americans. It's It's been said that that stopping illegal telemarketing, spam, and fraud over telecom is the single most bipartisan issue, the issue that most unites DC, and I would have to agree with that. And of course, I'm happy to support the item.
Thank you. Robocalls are annoying in a big way. They merit a response in a big way, too. We do that here by holding to account a company that made more than 500,000 robocalls to people they had no business calling. The company was doing a hard sell, offering health insurance and trying to take advantage of COVID-19 anxiety anytime anyone answered the phone. So we respond today with a $45 million fine for these junk calls because they violate our rules and the Telephone Consumer Protection Act. In fact, this is the largest fine ever proposed by this agency under this law. But our robocall efforts are bigger than this record fine today. We have required new call authentication technology on our networks. We have set up the first ever robocall mitigation database, a registry of every voice provider that is a public record of their anti-robocall practices. And just yesterday, we announced new partnerships. We now have 16 state attorneys general that have signed our memorandum of understanding, committing to share information and resources with us so we can work together to get these junk calls off the line. I want to thank specifically the state attorneys general of Colorado and Vermont for joining this effort, and the state attorneys general of Colorado, North Carolina, and Tennessee for the new initiative they set up to get other state attorneys general on board. I also think for this agency to be truly effective when it comes to stopping robocalls, more authority is needed. For starters, the decision last year by the Supreme Court in Facebook v. Duguid narrowed the definition of autodialer under the Telephone Consumer Protection Act, which could lead to less consumer protection from these annoying calls. We need to fix that. We also need more tools to catch those behind these calls, including the ability to seize assets, to stop them in their tracks, and even the authority to enable the FCC to go to court directly and collect against these bad actors, each and every one of them. Thank you to the agency staff who worked on these efforts, including Leon, Igal, and welcome again, Lisa Gelb, Rosemary Harrell, Jessica Manuel, Raul Rojo, Daniel Stepanisic, Christy Thompson, Ashley Tyson, and Lisa Zana from the Enforcement Bureau, Valerie Hill, Richard Mallon, Wissam Naum, William Richardson from the Office of General Counsel, Aaron Garza, Richard Smith, Mark Stone, Christy Thornton, and Kimberly Wild from the Consumer and Governmental Affairs Bureau, Pam Arlick, Matt Collins, and Chris Monteith from the Wireline Competition Bureau, and Susan Lee and Virginia Metallo from the Office of Economics and Analytics. And with that, we will bring the meeting to a close. So I will start by asking if any of my colleagues would like to make any announcements at this time. We'll start with Commissioner Carr.
Nothing here, thanks.
All right, he's silent. Commissioner Starks.
Yes, thank you, Madam Chairwoman. I do have an announcement in celebration, of course, of Black History Month. This upcoming Tuesday at 11 o'clock, I'm going to be hosting a virtual event entitled Connecting Black Communities. And more than anything, as my team and I were putting this together, I'm glad to say we will truly have the most impactful broadband policymakers that are going to be able to attend. That includes the House Majority Whip, Mr. Clyburn, the Commerce Secretary, Gina Raimondo, the White House Senior Advisor, Mitch Landrieu, of course, my colleagues, including the Chairwoman, Commissioner Carr, Commissioner Symington are also going to give some remarks. And then the panel itself is also going to be dynamic and hard-hitting. The Lieutenant Governor from Wisconsin, Mandela Barnes, the Lieutenant Governor from New York, Brian Benjamin, will talk about the state level that they view this issue at. The Mayor of Chicago, Miss Lori Lightfoot, the Mayor of Augusta, Georgia, Hardy Davis is going to be there talking about it at the local mayoral level. And then we'll also have the Office of Minority Broadband Initiatives there in NTIA represented. So it is going to be an event that I'm extremely excited about. And we are hoping folks will tune in. It's going to be, of course, live on fcc.gov live. So tune in Tuesday at 11. See you there.
Thank you, Commissioner Starks. I'm very much looking forward to joining you. Commissioner Symington, anything to add this morning?
I am also looking forward to joining my colleagues at Commissioner Starks' event next week. Other than that, I've got nothing comparably exciting. Thank you.
All right, so thank you, commissioners. Before we adjourn, I want to make a few brief announcements. First, Sharita Kennedy is retiring after 35 years of dedicated federal service. She's been a critical member of the Consumer and Governmental Affairs Bureau's Disabilities Rights Office, Consumer Engagement Team, where she's processed complaints and communicated with consumers. We're going to all miss her, so congratulations, Sharita, on your retirement. Next, Elizabeth Lyle's retiring on March 1st after 30 years in government and more than 25 of them at the FCC. Elizabeth has served the agency in so many roles, including most recently as Assistant General Counsel in the Office of the General Counsel's Administrative Law Division. And there she supervises the team that advises the agency on public accountability, transparency, and process requirements, including the Freedom of Information Act. And she also advises on a wide range of thorny legal questions. Her other roles at the agency have included agenda review attorney at OGC, where she advised on wireless and public safety issues, and senior legal advisor and special counsel to the Wireless Telecommunications Bureau Chief. And as an example of her accomplishments, in 1999 and again in 2011, she helped manage two major multi-bureau rulemakings promoting access to technologies for people with disabilities. And in 2010, she wrote a working paper in support of the accessibility recommendations in the FCC's National Broadband Plan. Before coming to the FCC, Elizabeth actually worked for Secretary Ron Brown at the Department of Commerce, and she served as an advisor at NTIA. She's known throughout the agency as a brilliant lawyer and skilled supervisor, but she's also a wise counselor who can solve problems no matter how novel or difficult. Elizabeth is a friend and mentor to so many FCCers, and she will truly be missed. Finally, Zaid Saleem is retiring after more than 19 years of service at the FCC, most recently serving as Associate Division Chief for Engineering in the Wireless Bureau's Competition and Infrastructure Policy Division. Zaid is known throughout the Commission, not only for his engineering expertise, but also for his kindness and thoughtfulness towards all of his colleagues. We're going to miss his practice of inviting colleagues to his office for a cup of coffee, as well as his stories of coaching soccer and contributing to the community. We wish all three of these folks well in their retirement. Madam Secretary, will you please announce the next date for the Commission's monthly agenda meeting?
The next agenda meeting of the Federal Communications Commission is Wednesday, March 16th, 2022.
All right, we've done this in record speed, and until then, we stand adjourned.